Hello, let's talk about cesarean section today. Cesarean section or C-section or CS for short. What exactly is cesarean section? Cesarean section is a surgical procedure done to remove the baby from the womb through the abdominal wall, cutting open the abdominal wall and cutting through the anterior uterine wall and bringing the baby out. The uterine wall is the wall of the uterus or the womb. So why is this done? There are certain reasons why this is an option to deliver a baby. What could these reasons be? What are the reasons why a doctor will recommend you to have a CS? Why not deliver by yourself? Why not deliver naturally through the vagina? These are the reasons we'll be discussing today. Stay tuned. So before we delve into the matter of cesarean section, I want to welcome you to my channel. I drop videos every week talking about varying health issues that might affect you, your neighbor, your friend, your family, anyone you know. So please subscribe if you are not subscribed yet to my channel. If you are interested in things like this, the videos I do, please hit the subscribe button and turn on your notification bell so that you know whenever I post videos. And to my returning subscribers, I really want to thank you guys. You guys have been really supportive and I appreciate. So let's go to the matter of the day. I've had situations where a mother comes to the hospital in labor and has been on for hours, and the patient is counseled for a cesarean section, but she refuses based on religious reasons and prefers or opts to hear from the pastor before they decide whether to go on with the cesarean section or not. Those situations usually end up fatal for the baby or for the mother. It is very, very important for you to know that there are real, actual reasons why your doctor will recommend you do a CS. Please and please, nobody wants to do CS just for doing sake. Nobody just wants to take you to the theater and cut you open. No one wants to just do that. Contrary to what you might think, the aim of CS is to have the best outcome for the mother and for the child. If you can't have the best of both, to have at least the best of one of the outcome, it is very, very important. So this is the reasons why CS might be suggested. Number one, there are factors. So we'll classify them into maternal factors that has to do with the mother, reasons that has to do with the mother, then fetal factors. These are the reasons that have to do with the child. So let's start with the fetal factors. The child might have what we call fetal distress. It means the child is not coping very well anymore. The heart rate of the child is waning. The child has been under labor for a while and is not doing fine. And if the situation is left to linger, the child might die in the womb. So in this condition, a condition like this, once the doctor or the midwife, they notice it, recommend a cesarean section for the patient. It is very, very important to save the life of the baby through CS in that instance. That's one. There are other factors, other fetal factors. Let's talk about the other factors. There is cord prolapse. In cord prolapse, the umbilical cord will be protruding out of the vagina or coming out of the womb ahead of the child. That is not a good thing. That's not what is supposed to happen in the normal sense. So in such a condition, would recommend a cesarean section. There are situations where the baby is not lying well in the womb. The baby is lying in a breech, we call it breech, or malpositioning or malpresentation. The best form of presentation is when the best form for delivery is when the baby's head is lying down first. It's going to come out first. The part that is closest to the vagina is the part that presents first. So if there is malpresentation or malpositioning or breech presentation, it's going to affect or prolong delivery. It's going to prolong delivery. In such a case, we recommend a cesarean section. This is common when there are multiple pregnancies. I mean, when the fetus is more than one, you might need to, okay, when the fetus is more than one, there is likelihood of malpositioning. So we prefer the first presenting baby to be cephalic, meaning the head is down first. If they are both malpositioned, there's a problem. If they are both breech, there's a problem. So positioning of the fetus is very, very important decision for either natural birth or cesarean section. So let's go ahead. Let's move forward. Fetal macrosomia. Fetal macrosomia means the baby is large, bigger than the normal baby size. If in this condition, there might be what we call cephalopelvic disproportion. It means the head, the presenting head, is too bigger than the pelvis, so it cannot pass through. It cannot be delivered via the vagina. In that case, vaginal birth is put aside in favor of cesarean section. So if the head cannot pass through, there is nothing you can do about it. You have to opt for cesarean section. So these are some of the reasons associated with the fetus that might make your doctor or your health practitioner recommend a cesarean section for you. There are other ones. If there's a case of failed induction of labor, maybe labor was not starting adequately or starting on time, and the health personnel opts for induction of labor to induce or to stimulate the beginning of labor. Then if that fails, the next option is cesarean section. If there is also a failed instrumental delivery, maybe they used a vacuum or they used other instruments to assist delivery via the vagina and it fails, the next available option is cesarean section. So these I've just added also relate to fetal factors. Fetal factors that might lead to cesarean section. So what about the maternal side of things? What are the maternal reasons or the mother related reasons why you may have to opt for cesarean section? One that is not commonly practiced here in our environment is maternal choice. Maybe in other countries it is commonly practiced, but it is not usually practiced here. Maternal choice, where the mother chooses to have a cesarean section. In that case, there are two types of CS. We're not talking about that emergency or elective. What those cases are usually elective CSs. We're not talking about that today. So the other commoner reasons or commoner indications why you might be recommended to do a CS. In our environment, in this place, as follows. 1. Preeclampsia or eclampsia. These are medical conditions where the mother has a very the mother is hypertensive. The hypertension started in her pregnancy as a result of her pregnancy, and it has gotten to a point where she is convulsing. So eclampsia, preeclampsia, they are all emergency situations that requires the child to be birthed via CS. A CS would be the solution to eclampsia or preeclampsia. There are other ways, medical ways of managing preeclampsia, but if a woman has preeclampsia, the safest way to delivery is cesarean section. Number 2, if there have been previous cesarean section, 2 previous cesarean section. If there has been 2 previous cesarean section, it is very important that the next one be cesarean section as well. There is a chance for what we call VBAC, that's vaginal birth after cesarean section, vaginal birth after CS. But there are criteria, various criteria to qualify for that. We're not going to delve into that, but what we're looking at is the case where you've had 2 previous CS before. It means your womb has become weakened due to scars you've acquired before, that you need, the next one has to be through CS as well. So another one is a previous myomectomy. If you've had a myomectomy before, a myomectomy is a surgical operation where a fibroid is removed from your womb. So myomectomy is the removal of fibroid. So if you've had that done before, you might want to opt for CS. Another indication or another reason is maternal disease. If there's maternal disease, maybe the mother is sick, then labor then setting, you might want to do a CS. So if the mother has also CA cervix, if there is cervical cancer, you might want to do a CS. So these are the indications for, or these are the reasons why your doctor would want you to do a cesarean section. These are the reasons why your doctor will want you to do a cesarean section. Please hit the like button and share this video so that a lot more people can see it and learn. So give this video a thumbs up if you've enjoyed it. Share to your friends, to your relatives, so they can also learn. Thank you very much for listening. Bye-bye.